My name is Kaveh Khoshnood. I'm a faculty member at the Yale School of Public Health. I hope all of you and your loved ones are safe and doing well. I want to thank the Council on Middle East Studies for hosting this event and inviting me to interview Professor Marcia Inhorn and moderate this discussion. This is one of a series of conversations that's been going on with faculty who have released their books. I'm a huge fan of Professor Inhorn and her fantastic work. It is truly an honor and pleasure to have this conversation with you. Today's discussion is focused on Professor Inhorn's 2018 book entitled America's Arab Refugees, Vulnerability and Health on the Margins. This is a fantastic book with great reviews that brings deep ethnography, politics, and public health together, and is focused on an important and timely topic, namely wars and the global crisis of refugees and forcibly displaced populations, with a particular focus on the Arab refugees in the United States. Before starting our conversation, I'd like to read a short bio of Professor Inhorn. Marcia C. Inhorn is the William K. Lanman Professor of Anthropology and International Affairs in the Department of Anthropology and the MacMillan Center for International Area Studies at Yale University, where she serves as the chair of the Council on Middle East Studies. A medical anthropologist specializing in Middle Eastern gender, religion, and reproductive health issues, Professor Inhorn has conducted research in Egypt, Lebanon, United Arab Emirates, and Arab America over the last 30 years. She's the author of 6 books on the subject, including her latest book that we'll be discussing today, called America's Arab Refugees, Vulnerability and Health on the Margins, published by Stanford University Press. Professor Inhorn is also the founding editor of the Journal of the Middle East Women's Studies and has received numerous awards for her books and scholarship, including the Middle East Distinguished Scholar Award from the Middle East section of the American Anthropological Association. Professor Inhorn, welcome.
Oh,
so
thank
wonderful.
you. Thank you, Professor Khoshnood. A wonderful colleague here at Yale, and I'm really honored that you're the one hosting my book talk today. Thank you for doing that.
Thank you very much. So I'm going to start today's conversation by asking a few questions. We will then open it up to all the participants to ask their questions. Please submit your question in the questions and answer tab. So to get started, I'd like to actually start by the title of your book. And if there's a backstory about the choice of the title, it is called America's Arab Refugees. The title could have been Arab Refugees in America. Was there a reason the book was titled America's Arab Refugees?
Yes, I mean, that's a great question. You know, one always has to figure out what is the right title for a particular book, a particular study. And I felt pretty strongly this should be America's possessive, America's Arab refugees, because these are refugees who've come to this country, and America, the United States, I want to argue, really has a moral responsibility to care for these Arab refugees. Particularly, I want to say, because some of these refugees who fled from the Middle East, they've been forcibly displaced by wars that the United States perpetrated in the Middle East, particularly in Iraq, in the country of Iraq. I mean, I should remind all of us, the US has had 2 major military interventions in Iraq. The first so-called Gulf War in 1990, 1991, and then in 2003 again, the US-led war in Iraq that went on officially until 2011, although still there are American troops on the ground in Iraq. So there's been forcible displacement in the Middle Eastern region, really caused by the US, by America. And so, you know, a major sort of question is, what does America owe to Arab refugees, particularly those who have been displaced by American military intervention? And I think that's probably the main question, you know, of my book or my study, the thing that I'm asking, what does America owe to Arab refugees? How should America care for Arab refugees? You know, what is our moral obligation? What is our obligation to refugees as part of the broader issue of refugees coming into this country?
Thank you. Detroit, Michigan is sometimes, where you did your study, is sometimes referred to as the capital of Arab America. Can you tell us a brief history of why so many Arab immigrants and refugees ended up in Detroit, Michigan, which, by the way, has experienced serious economic impoverishments for many years?
Yeah, it's a very interesting story. Actually, if you look at the history of Arab immigration to the Metro Detroit area, it actually started around the turn of the 20th century in the early 1900s. And it has something to do with Henry Ford and automaking in Detroit and the recruitment of Arabs from countries such as Syria and Yemen to come over and work in the auto factories. So there's a long history of Arabs living in Michigan, and especially in the metropolitan Detroit area. But the real influx of Arabs into Metro Detroit, and particularly to a southwestern suburb immediately attached to Detroit proper, a place called Dearborn, Michigan, which is really on the margin of Metro Detroit, of the city of Detroit. A huge influx of Arabs started after World War II in the 1950s and 60s, really with sort of each passing decade of war. First, Palestinians fleeing from the Middle Eastern region came, and then Lebanese fleeing from the civil war in Lebanon, and then later the 10 years of occupation of southern Lebanon. And then in the early 1990s to mid 1990s, Iraqis started coming, Iraqis who had been forced into refugee camps in Saudi Arabia, got admission to the United States after, you know, trying to fight Saddam Hussein. And so they started coming in the 1990s, Iraqis, the first wave. And then eventually, again, after the next war in Iraq that started in the early 2000s, by the mid 2000s, more Iraqis started coming in to Michigan. And so there have been really, I would say, you know, three primary groups of fleeing Arabs coming into the Detroit area: Palestinians, Lebanese, and Iraqis. And so there's this large population of people who have come because of wars, and Arab Detroit, which is what it's been called by various authors, it is the largest Arab ethnic enclave community in North America. There are thousands of people of Arab descent living in the greater metropolitan Detroit area. Some doing really well, I want to say. There have been scholars who talked about how Arabs have moved from the margins to mainstream in America and have done very well for themselves. But the group of people that I studied, that I ended up really meeting in my 5-year study that I'm happy to talk about, they were not a population doing particularly well. There were high levels of poverty. And that, as you point out, is really indicative of the city of Detroit, which has gone through huge economic downturn. I mean, the auto industry, if you'll recall, was really affected even before the Great Recession of 2008. Barack Obama had to really intervene to try to save the auto industry. And, you know, Metro Detroit is really affected by the auto industry. And so, you know, by 2013, the city of Detroit had to declare Chapter 13 bankruptcy. The city, there are high areas of really concentrated poverty in the city of Detroit. And the Arab refugees that I was working with were really on the margins. They were not a group doing very well economically. A lot of them were really struggling as part of the larger struggle, I would say, of many people living in the city of Detroit and in the great state of Michigan, which has really had, you know, hard economic times in these past couple of decades.
Thank you. You brought up Iraq, and your book has a particular focus on Iraq and Lebanon.
Mm-hmm.
And in fact, your book starts with a timeline of the wars that have been going on in Lebanon and Iraq. Mm-hmm. Can you tell us a little bit about the wars in these two countries, the forced displacement of their people, and the role that the US government has had in these wars?
Yeah, I ended up focusing on Lebanon and Iraq because those were the two major populations that I was working with in Arab Detroit. And the Lebanese came before the Iraqis. Lebanese, particularly from the southern part of Lebanon, who were mostly Shia Muslims, started really fleeing southern Lebanon in the mid 1970s because, as you know, Kaveh, because you work in Lebanon, there was a long and brutal war from 1975 until 1990, a 15-year civil war that was really affecting a pretty poor rural Shia Muslim population that lived in southern Lebanon. And so a lot of Lebanese Shia Muslims started coming over to the US in the 1970s and 1980s. The US did get involved. As you might recall, in 1983, there were Marines, American Marines, in a military encampment outside of Beirut, and there was a horrible bombing and the death of quite a few American soldiers. There were bombings of the US Embassy and of, American places were targeted in Beirut. And so America was involved in Lebanon. I wouldn't say it was a major involvement. There were other external actors that were deeply involved in that war. But Lebanon went through a very tragic and very long and very difficult war, followed then from 1990 to 2000 by the occupation of southern Lebanon by the state of Israel, which again really affected the southern Lebanese Shia Muslim population. So for that long period from 75 to 2000, Lebanese who could get out of the country, I mean, they tended to scatter to many different places. Many went to Africa. There were enclaves of Lebanese who fled to parts of Africa, but a substantial portion of Lebanese did flee those very difficult, the political violence, and did end up in America, and many in the sort of Arab Detroit region. Then for Iraqis, the first influx of Iraqi refugees to Michigan came after the first Gulf War. That was a very short war. It didn't, last for a very long time. But as you recall, it occurred because Iraq under Saddam Hussein invaded the neighboring country of Kuwait, and so this country, under the leadership of George H.W. Bush, the senior Bush, decided to defend the interests of Kuwait, and had a war that involved a lot of aerial bombing and actually encouraged Shia Muslim Iraqis to rise up against Saddam Hussein, which they did. But then when the war ended and Saddam stayed in power, those Iraqis had to flee. They mostly first went to Saudi Arabia, and eventually in a 10-year period, many of them did gain refugee admission to the United States. And again, initially, Iraqis were sort of placed all over the United States, but something happened very commonly. It's called secondary migration, where people migrate a second time within the host country to try to be in a place where they feel culturally safe. And because Michigan already had this reputation as a sort of Arab ethnic enclave, many Iraqis from that first wave of refugees did end up settling in Arab Detroit. And then later when the second wave of Iraqi refugees from the 2003 American War started coming in the year 2007, 2008, again, many of them just were placed immediately in Michigan because there was already an Iraqi population there. So in my book, I describe these sort of waves of war in the Middle East. The first chapter is called Why Arabs Fled. I mean, people are not fleeing for no reason. They're fleeing from devastating wars in their country. And I spend the second chapter of the book, it's about the syndemics of war, arguing that wars, all the devastation, create these sort of synergistic epidemics of physical, mental, reproductive, infrastructural, and environmental health problems that really take a toll on a country when it's going through a war. And I spell out for both Lebanon and Iraq what has happened in those countries in terms of destruction, death, environmental toxins, reproductive health problems, child health problems. I really go sort of step by step through those syndemics of suffering in both Lebanon and Iraq. And the legacies are really long lasting, I do have to say.
You brought up a lot of the health issues. In your book, you do describe sort of major health challenges that this growing Arab refugee population is facing, including the lingering health effects of war, lack of access to quality health services, post-war reproductive health impairment. Especially you talk about male infertility, which was actually quite high, especially among the Iraqi population, and also lack of access to IVF, in vitro fertilization, which is quite expensive.
Mm-hmm.
And then in chapter 3, you sort of focus on reproductive health challenges faced by both poor Arabs as well as poor Black community in Detroit. And then you use a term, stratified reproduction, to describe their experience. Can you tell us what is meant by stratified reproduction?
Right. So I am, as you introduced me, I am a medical anthropologist. And I actually have to say I'm one of the relatively few medical anthropologists working in the Middle Eastern region. There aren't that many of us, and in particular, I'm an anthropologist of reproduction. I really have been focusing on reproductive health issues for my whole career, beginning with trying to understand infertility in the Middle Eastern region and how devastating it is to infertile women and men in a part of the world where the majority of adults marry, the majority of adults want children. It's a very marriage and child-centric part of the world. People really love children and want to have children. And it's sort of what's seen as solidifying a relationship, a marital relationship. And so I've been studying infertility in the region for a long time, both female infertility and male infertility. And coming back to my home country, I've done all my research outside in the Middle East. And this is really the first time I ever worked with a Middle Eastern population in the United States. And I was working out of a reproductive health clinic in Dearborn in Arab Detroit, really focusing on infertility and in vitro fertilization, IVF, which is the technology, the expensive technology that's sometimes needed to overcome infertility problems. And so, yes, there were high rates of male infertility in particular. Male infertility is one of those hidden reproductive health problems. We never talk about it, but just so everyone knows, around the world, around the globe, when you look at the overall infertility problem, infertility affects somewhere between 10 and 30% of populations. It's not an insignificant reproductive health problem, but of those problems, of when couples are involuntarily childless, more than half of the cases involve a male infertility problem. So male infertility is a very widespread reproductive health problem, one that we never talk about. And I saw it in this clinic in Dearborn, where many men suffered from pretty serious, pretty severe forms of male infertility. I mean, they had problems with sperm count, with the movement of their sperm. And unfortunately, really one of the only solutions is a very expensive form of IVF called intracytoplasmic sperm injection. In the United States, a single cycle of ICSI, as it's called, costs between $12,000 and $15,000 US to do one cycle. And it's one of those health technologies that is not supported by health insurance in most places, by the Affordable Care Act, doesn't cover it. You're on your own when you're infertile in most cases. And so in this population, working with these people who really wanted to start over in America, they really wanted to have a child after everything that they'd been through. Some of these men had been through horrible stories of torture and injury and, devastation. And they were hoping to have a child, only to find out that they faced a serious infertility problem, a male infertility problem, and that the solution was a $10,000 to $15,000 single cycle of a technology that only has about a 25% success rate. And so they were really stuck. There was no way most of these couples would ever be able to afford this technology. I mean, very few people. I interviewed almost 100 people over 5 years, going back and forth between where I was at the University of Michigan and this clinic, and very few people were able to access the technology. Very few babies were born. And I ended up, one of your great questions, I ended up feeling that these people were in a state of reproductive exile, okay? That they couldn't access reproductive health care in America, but they were exiled from their home country. They couldn't go back to their home country. And in Iraq, the medical infrastructure has been devastated. So it wasn't like they were going to be able to go back and get IVF there. And so this notion of stratified reproduction, that's not my term. Reproductive exile is my term. But stratified reproduction is a very famous term in our field. speaking about the fact that some people get to reproduce, they get their choice of reproductive technology, they have agency in their reproductive lives. They never have to worry about, you know, having children, affording technology, being able to access and have reproductive choice. But a lot of people in the world don't. And therefore, one's ability to be a reproducer is very stratified based on where you are in the sort of economic hierarchy. And also in the world, there are really notions out there that some people deserve to have children and some people do not deserve to have children. And stratified reproduction really gets at that notion of, you know, unfortunate notion that there are some people who just really shouldn't be having children. And we see that, you know, in many discourses that are really pretty racist. And so in this situation of Detroit, I talked about the marginalization and really racism against populations that, you know, many Americans don't want to think about Arab refugees, and many white Americans don't really want to think about issues having to do with, you know, Black Americans. And we know from research that there is really a lot of reproductive racism out there in the world. And so I tried to sort of talk about that, especially given that, you know, Arab Detroit is really deeply enmeshed with Black Detroit, a great Black city, and that both of these populations struggle to get access to infertility care. So I have a whole chapter of this book really talking about health inequities, health disparities, you know, marginalization, just vulnerability, lack of access to good health when you just don't have economic resources in this country.
In the last chapter of your book, you share the concerns of your study population, as well as your own concern about the future of what you refer to as structurally vulnerable Arab Muslim refugee population in the United States, given, as you mentioned, ongoing wars in Middle East, the political climate in the United States, which of course is changing literally by the minute right now. And you advocate, as you mentioned in the beginning, that America's moral obligation to help Arab refugee populations in need. And you also advocate for your own colleagues, anthropologist colleagues, to take a stronger stand against war and do more for refugee health and well-being. You know, turning to our own academic institutions, how do you think Yale and other well-resourced academic institutions can respond to your call?
Yeah, so I really want America to step up for, for refugees. We have a history. Obviously, America is a country of refugees, people fleeing other places, other oppressions. And so our whole history of this country is taking people in. And we have had really, over the last, since World War II, we have taken in refugee populations. We took in thousands of Vietnamese refugees in the 1980s in this country after the Vietnam War, which America, initiated a long and deadly war, and supported Vietnamese refugees, gave 3 years of assistance, and really helped to get that refugee population off the ground. It's a population that's done really very well in America, very well as a refugee population. And we have had decade after decade refugee admissions from many different parts of the world. Ethiopia, Somalia, Bosnia, parts of Southeast Asia, Cambodia, Myanmar. I mean, this is a country that has a history of doing well by refugees. That has shifted, I must say, really, I would say probably in the wake of 9/11, which was a defining moment in America. I think there's been more of a questioning and the reluctance, I think, in America to consider taking in refugees, particularly from Arab and Muslim places, as we know. And as I ended my book, I really was at that moment of discussing the Muslim ban that was then, enacted with the support of the Supreme Court in 2016. And so really questioning, is America not going to be a welcoming place anymore for refugees and for Arab and other Muslim refugees, including refugees who are not Arab, but from the country of Afghanistan, where the US is still in its longest war. I mean, it's going into 2 decades of war in Afghanistan. And so what do we owe to Afghans who've been displaced by war? So I believe that we have a moral obligation, I really call in this book, for an obligation to take care of refugees, particularly from places where we've had the major role in unseating them from their countries. And I want to say, and back to what you just asked me about Yale and our colleagues, I do feel a certain pride in this community in New Haven and in Yale as an institution, and in, you know, the sector here that's a refugee serving sector. We have IRIS, Integrated Refugee and Immigrant Services. I hope I got that right, but IRIS is our local resettlement agency that has done a lot in the last decade to bring in Iraqi, Syrian, and Afghan refugees into this community. And the Yale Law School has helped with that, really has challenged the Muslim ban in court. And we have the Yale Medical School and Public Health School. We have a refugee and asylum medicine clinic here. This is a community with a lot of religious organizations too in our area that has done a lot to help refugee families really get off the ground. And I have to say with great pride that our Council on Middle East Studies has hired some most fabulous Iraqi refugees in the last decade or so who've made such a great contribution to our council. So, you know, I do believe that there are places in America that have their arms open and are welcoming. And I really believe we need to continue with that, you know, endeavor to bring people fleeing from places that are, you know, affected by war, to bring them to this country where they have a chance to remake a life and to settle and to live the American dream. And refugees want to live the American dream, you know, they really do. I have to say something really important. No refugee from any country has ever committed a terrorist act on US soil. This is not a population that is here to disrupt anything or bring violence to this country. This is a population fleeing violence that wants to live in a safe haven, and they want to come to a place where they can thrive, their children can thrive, they can have babies, they can have new lives and homes. And so that is what refugees, generally speaking, want when they come here, and we need to do something to help them. I do have to say, unfortunately, I mean, the sad part is that the US is no longer such an assisting country. We don't give the 3 years of assistance in this country anymore. It's been reduced through welfare reform to 8 months of assistance, cash assistance. And so there's a lot of pressure for newly arriving refugees in this country to immediately find employment so that they can be self-supporting. And that often leads to people being sort of channeled into very low paying jobs, often having to work 2 or even 3 jobs to support themselves and their families, and never really getting a chance to learn English well enough, to be recertified and retrained in the professions that they often held in their home countries, people who were engineers and physicians and specialists, you know, to come and get recertified to be able to do the thing that they did. So we could be doing a lot more in this country to really help and to support people and give them that safety net for a bit longer so that they really could establish themselves in this country.
Thank you for that. I have a bunch of other questions, but I want to open it up to the participants. I do see one question. I don't know if you're able to see it from Jonas.
Jonas.
This is a very fascinating book. I urge everyone to read it. One of the arguments in this book puts a huge emphasis on the US government to fulfill its moral obligation toward this vulnerable population, urging policymakers to consider issues related to healthcare equity and social justice, something you just talked about. So how should we envision the future of Arab refugees in the United States? Can one see any glimpses of hope, hopefully under Biden? Should the US admit more refugees to hold up their end of the bargain? Also, Jonas had a question about the IVF. You mentioned infertility, IVF, ICSI. It's not included in Affordable Care Act. It's not covered by insurance. And I guess Jonas was asking whether there's any push to make that, given that it's clearly a health issue. Why is this not covered under health insurance?
Yeah, I'll start with that. Thank you, Jonas. Jonas is wonderful, our colleague, an Arabic professor here at Yale, and has been a great interlocutor, has read my book, reviewed my book. Thank you, Jonas, out there. I'll start with the second question first about, why no infertility coverage for IVF or ICSI under Affordable Care Act. I think the Affordable Care Act sees itself as a sort of very basic coverage for sort of basic medical conditions, and doesn't see itself as really being able perhaps to cover kind of a very expensive form of treatment which is required, that unfortunately too often is seen as a luxury treatment. Well, you can live without children. It's really a luxury to be able to, go to IVF or ICSI. And in fact, many people in America want to pursue IVF and ICSI and they don't get a chance to. It's simply too expensive for the majority of Americans. So the ACA, the Affordable Care Act, just didn't include infertility care in its coverage. Very disappointing to me. And I think I feel more disappointed because, of course, we associate the Affordable Care Act with President Obama. And Michelle Obama has written a wonderful book called Becoming, where she really is open about the fact that she and Barack had infertility problems and they pursued IVF. Their children are IVF children. And we know that Barack Obama is a, caring father. And so I felt like, wow, if it could have just been included in the ACA, many more people in America would have a chance to, access IVF, but it didn't happen. So maybe for the future, if we hopefully retain the Affordable Care Act, maybe that's something that people will end up fighting for as a reproductive justice issue. And especially, in the book, I talk about infertility and minority infertility. In this country, the populations that really don't get good access to IVF and ICSI are minority populations. We know that. There's not enough research on minority populations and infertility, but they're the populations that are just really pushed out of this very expensive kind of assisted reproduction. So we need to do better on that front. In terms of refugees, I do want to say that under the last 4 years, refugee admissions in this country are at their very lowest point, historically low point. This has not been a welcoming regime in terms of bringing refugees into this country. And in fact, President Trump last year wanted to bring refugee admissions to zero, no more refugees at all from any country admitted into the United States. That didn't hold, but the refugee cap was put at 18,000 people, which is historically low. In the latter part of Barack Obama's presidency, there were about 70 to 80,000 refugees being admitted to this country every year. So we're at a low point now in terms of refugee admissions. And I can tell you that, for example, Syrian refugees, there are millions of displaced Syrians in the world. And Syrians, America has not done its fair share in bringing Syrian refugees into this country. Oxfam issued a really important report in about 2016, 2017, showing that the United States had done an abysmal job in terms of its fair share of Syrian refugee admissions, especially compared to some other countries like Germany, which has done a remarkable job. And it's really important to point out that most refugees from Syria, they're not in Euro-America, they're not in the United States, they're not even in Europe. They're living in neighboring Middle Eastern countries. It's the countries of Lebanon. Fragile Lebanon has got 1.5 million Syrians, as we heard about in our previous panel that you moderated on Lebanon. It's got a huge, 1 in every 4 people in Lebanon is Syrian. Right. Jordan, the country of Jordan, and Turkey, not an Arabic speaking country, but Turkey's taken in a huge number of Syrian refugees. So it's really the Middle Eastern countries that are holding the burden of refugees. And, what could Europe and the United States be doing to make things better? I do hope, Jonas, per your question, I do hope that things are going to get better and that we will increase the refugee admissions cap in the next years and to bring in more vulnerable people who, again, I must reiterate, they're fleeing because they have to. They've been displaced, they've been injured, their families have been harmed, and they want to be in a place of safety. And they want to live that American dream.
Thank you. There's a question from Nahid Siamdoust, who was a postdoctoral fellow at Yale. She's thanking you, Marcia, for a great book. And she's asking a question about some of the challenges you face as an ethnographer given the sensitivity of the subject that you were researching, how did you manage to have these very sensitive conversations about tough issues like infertility with Arab-speaking population, study population?
Oh, thank you, Nahid. We miss you here at the Council on Middle East Studies at Yale. Thanks for being on in the audience. Yeah, you know, I've been working on infertility for it's maybe more than 30 years in the Middle East. And it is a sensitive topic. I mean, perhaps especially for men, I will say it's often confused. When we say that a man is infertile, people often think that somehow he's got erectile dysfunction, he's impotent. That is not what male infertility really is. It's about problems having to do with spermatozoa. It's a problem, you know, that people don't usually know that they have until they get married, and then they can't impregnate their wives. And so it is a sensitive issue. And for the first part of my career, I worked completely with women who were infertile in Egypt, mostly in Egypt, and nobody ever refused to speak to me. I mean, women wanted to pour out their heartbreaking infertility stories to me. And it was also there in Egypt where I started that I learned that often they were shouldering the sort of burden of their husband's infertility. And I saw that when I finally started actually studying in vitro fertilization in clinics in Egypt. That's where the men were. The men were accompanying their wives after the IVF procedure, sitting in hospital rooms with them and wanting to talk. I wasn't prepared to talk to men, especially men who were infertile, but I found that the majority of the IVF cases in Egypt were really because men were infertile and they wanted to talk. And so I didn't think I was the right person to do this. You know, I really thought that a man should really study male infertility. I tried to get a graduate student to feel that that would be an important project. And actually, it was an Arab colleague, a lovely colleague, Leusine Ouzgain in Canada, who convinced me that I actually might be in a better position to try to talk to Arab men about male infertility in particular, because I am not from there. I'm sort of seen as a doctora, a doctor. I have a public health degree and an anthropology degree. I'm more than middle-aged, kind of maternal, and that I might actually be a sort of a comforting person to have this conversation with. So he convinced me I should write the grant proposal and do it myself, and I did. I first started studying male infertility in Lebanon, and it wasn't that men were completely willing to speak with me. There were men who just said, no, I don't want to talk about it, but a lot did. I mean, I ended up talking to more than 200 Lebanese, Palestinian, and Syrian men about infertility, including their wives' infertility. And many of these men were so compassionate. They loved their wives. They wanted to stay with their infertile wives. They were doing everything they could to help them. So I had a huge study in Lebanon. And because I'm a medical anthropologist, we absolutely are required in the kind of work that I do and you do, Kaveh. You have to use informed consent forms to speak to human subjects facing vulnerable conditions. And so you have a consent form in Arabic or English, and you ask people to really carefully read it. And when they do, and they have to sign off saying that they're comfortable speaking to you, once they get past that point and are convinced that this is private, anonymous, that their story is not going to be broadcast in the newspaper, it was an outpouring. I mean, people who have been suffering from infertility and going through treatment and wanting a child desperately and not being able to have one, it's often cathartic. It's an outpouring. People want to tell their story. And I have had many people, both men and women, say to me, oh my God, I got that off my chest. I have never told anybody this before. You know, it's almost a therapeutic encounter. In fact, I have published one article in Anthropology Quarterly calling that IVF ethnography, calling it Middle Eastern Muslim men's confessional. I mean, I was almost a confessor. You know, they told me about things that they felt bad about. So if you're in the right stage of your life, in the right place, in a private setting, and people are convinced it's going to be anonymous and confidential, people will tell you about their illness stories. In medical anthropology, we call these illness narratives, you know, and we collect them, and they're often heartbreaking. I mean, honestly, there were times I was really moved to tears, and men and women were too, telling their stories. But I think it's really important to hear people's stories of reproductive heartbreak. And I've gone through my own reproductive heartbreak. And I think that that makes me especially empathic, perhaps, to know what people are going through when they're struggling to become parents.
I don't know if you mentioned this, but you also speak Arabic, and I have a feeling that had probably also a major role in them feeling comfortable speaking with you sometimes in Arabic language as
Yeah.
opposed to English.
Yeah, in all places I've spoken Arabic, and in Lebanon, I have to say there are a lot of excellent English speakers. It was the one place where I think I spoke the most English with people who wanted to sort of practice English. But yeah, no, that was really important. And having Arabic consent forms too, really, really important.
There's a question about male infertility among the Iraqi refugees. I think in your book, if I remember correctly, was it 65%, something like that? It was a very high. Is that related to impacts of war, or do we understand why male infertility among the Iraqis is so high?
Yeah, I mean, in general, as I said, in any given case of infertility or involuntary childlessness, it's about 50-50 male female problems. And globally, we know that more than 50% of cases of involuntary childlessness involve a male infertility factor. But in the Middle Eastern region in general, there are high rates of male infertility. I mean, I found it in Lebanon and in Egypt. The doctors there know about it, and they have their own sort of theories about it. I do believe that a lot of it has a genetic basis. We know that a lot of male infertility does have a genetic basis. And you see in the Middle East that there are family clusters of many men, brothers having infertility. And there are a whole bunch of genetic, sort of issues, deletions on the Y chromosome, actually cystic fibrosis. There can be a genital form that involves blockage of the sort of seminal vessels. So there are genetic reasons, which I think are very important for this region. But also, Iraqis who've been through war, a sad story that I recount in this book is that the US has used massive amounts of what we would call chemical weapons in Iraq. Very sad story. Heavy bombing with a substance called depleted uranium, or DU. It's a radioactive toxin. It's used to armor tanks and to armor bullets. And thousands, hundreds of thousands of rounds of depleted uranium armaments have been left in particular areas in Iraq. And we know it's radioactive. The half-life is something like 4.5 billion years. And so there are huge environmental legacies left in the country of Iraq from the two American-led wars in that country. And, there's been a concern about DU exposure among American soldiers and veterans. There have been some studies going on that really show that there are reproductive impairments that happen because of exposure, friendly fire exposure to DU. There have been major studies following, US and UK veterans. There's actually a great book by another medical anthropologist about UK veterans of the first Gulf War called Impotent Warriors, talking about reproductive problems among UK veterans of that war. And so it could be that people who've just been exposed to DU and other chemicals that were used in warfare in Iraq are going to have higher rates of reproductive impairment. And I talk about, with some of the Iraqi men in this book said, we know about DU. We heard about depleted uranium. If you talk to all of the Iraqi guys in my neighborhood, so many of them are infertile. We all went through the same war. We all went through the same exposures, something's going on. I mean, they're making the connection in this case. And sadly, we know that there are cancer clusters in the country of Iraq. Child health, early childhood cancers, congenital malformations and cancer clusters. And we know that what's happened in Iraq in terms of chemicals and armaments used in that country have had a major deleterious impact on human health. And I do recount that story in this book.
There's a question about the pandemic, which I assume is COVID-19. I recognize that your book, your data was collected several years ago. Are you or your colleagues aware of how COVID-19 has affected the refugee population in Michigan, or is this something you're aware of?
I am not following COVID right now. I mean, I must say, I mean, I am following it just sort of in an interested public health kind of way, but I haven't done a study. We
Mm-hmm.
do know that Detroit early on was one of the high impact areas for COVID transmission. It was very affected. And we know that Black communities in Detroit were very affected. And I'm assuming that Arab refugees were also affected, although I haven't seen any reportage. I haven't seen any reports coming out of the Arab part of Detroit about what's
Mm-hmm.
happened there. We do know the Middle East has been seriously affected by COVID. We do know that it's a real concern in refugee camps in the Middle East, that there could
Right.
be serious COVID outbreaks. And I did see a very powerful, I believe it was a BBC documentary. It was made by British documentarians about the devastation of COVID now in parts of southern Iraq that were also extremely affected by military intervention and just massive deaths. And these, you know, actually sort of brigades of Shia Muslim men who are doing the body management, you know, taking people who are very sick to the hospital. The hospitals are very underprepared in Iraq. They've been very seriously affected and underprepared for the sort of massive COVID epidemic in their midst. One of the sad stories of Iraq in terms of what also happened because of the war is that so many Iraqi clinicians, doctors, nurses, you know, clinicians fled that country because they were being targeted and kidnapped and killed. And so the infrastructure, the medical infrastructure in Iraq is ill prepared for a pandemic like COVID. And so, you know, Lebanon's got a COVID epidemic made worse by the displacement of 300,000 people because of the huge blast that just happened in, you know, the port of Lebanon. You know, the region is facing it. We know Iran has been one of the epicenters of COVID. Yeah, so the region's facing a hard time with COVID, but it's not something as a medical anthropologist that I've actually studied directly.
Sounds
But a
like
good question. A good
yeah, and that would be a great research project for some students or faculty to take on. Um, there's a question from Evren. Marcia, have you encountered grassroots organizing in Detroit that brings together Arab refugees and African Americans around racism and reproductive politics, populations, both of which suffer from stratified reproduction, as you have emphasized? Do people you have spoken with see these problems as structural issues that they have in common?
Well, I wish I could give you a good answer to that excellent question, Evren, because in my book, I really talk about minority infertility and reproductive racism affecting both communities equally. I mean, sadly, I mean, there's one thing to say first about, you know, Arab community, Arab couples who face infertility are generally speaking trying to keep it as quiet as possible. It's a stigmatized condition to be infertile. You know, it's something that people are not really talking about too much, you know, that they're infertile, they're facing infertility problems. It's not a condition that there's a lot of rallying to sort of come together for. And I never knew of a support group in any Middle Eastern country or in Arab Detroit. I never knew of an infertility support group. And I talked to clinicians like, why don't people come together in a kind of activist support group? They said, are you kidding? Nobody wants to sit there and maybe see people that they know and talk about infertility. So sadly, I've never seen very much activism in sort of the Arab community around infertility. Although in America, we do have huge infertility support community. The big one is called Resolve in America. It's a huge infertility support kind of institution, a nonprofit, and there are infertility support groups. There are also pregnancy loss support groups, which I myself was part of. I lost twins, and it's called SHARE. So in America, you can join these groups, but I never saw it going on in Arab Detroit in when I was doing my research there. And similarly, I feel, you know, very seriously sad. Another tragedy is that African Americans suffer from infertility just like white Americans and Arab Americans, and very few people are studying it. There's one study I know, my colleague at the University of Michigan, Rosie Savaggio, she's the only person that I know of to this day who's ever done a study of African American infertility. It just seems as if the research on African American health issues just doesn't care about infertility, that, you know, Black men and women might be infertile. And again, that's racist. I mean, that's reproductive racism, that we shouldn't care about the fact that they suffer from infertility problems. And I mean, Dorothy Roberts, a great feminist scholar, a legal scholar, who's written a powerful book called Killing the Black Body, has a whole chapter in there about Black infertility and the sort of lack of access to assisted reproductive technologies. And so we need more reproductive activism. We need somebody to care about this issue. Hopefully it's something that in the next, before 2050, that there will be activism along these lines. I mean, there are reproductive justice movements going on in America, especially around issues of Black maternal mortality, very high in this country, Black infant mortality, very high in this country, prematurity. There is a movement to try to do something about these kinds of, health indicators, but I've never seen anything like this for infertility. Very sad to say.
Sounds like another great project for students and faculty to
project.
get involved. So my colleague, I see Dini Harsono has a question. She likes your talk, hasn't had a chance to read your book, looking forward to reading it. Her question is, to address the challenges in providing healthcare, including mental health support to Arab refugees in the US, what kind of research would you suggest can better inform policy and practice? Have you engaged care providers and community-based organizations in your research to hear from their perspective? So with a focus on mental health issues.
Yeah, I do cover mental health issues in this book. I talk about what we know about what happened to mental health in Lebanon and what we know about what has happened to mental health in Iraq, and then what we know, the little we know about Arab refugee health in general in this country, including mental health, okay? And again, talk about like what we don't know. There was one major Centers for Disease Control, CDC study done in the mid of last decade, around 2015, trying to assess what is the state of Arab refugee health in this country, including mental health. And they tried to find, particularly Iraqis, to find them. And the sad part is they couldn't even trace most Iraqi refugees. It was hard to find people. They had come to this country. There was no follow-up as to what happened to them, where they went. I mean, that was one of their struggles, absolutely being able to find, refugees in this country, which goes to show that we haven't done a good job if they can't even be traced and found. Like, where have they moved? No case follow-up. But what they did find is that there were significant unemployment problems, underemployment. People were really suffering economically. And along with that, there were serious, affective mental health problems, depression, anxiety, which you can understand if, high rates of unemployment, movement, not having a secure place to live. And so we know that there are mental health issues in the refugee community in this country. We don't know enough about them. But again, I'm not a mental health specialist. I'm a reproductive health specialist. But I have to say, I believe our colleagues in the Yale School of Medicine and the School of Public Health are really concerned about this. There is a sort of Muslim mental health initiative. There's a Journal of Muslim Mental Health, which some of our colleagues have been very involved in. And so there are caring clinicians and practitioners who are trying to address, the trauma and the current mental health issues of this population. And so there are people who care. It's not something that I follow closely, I have to say, because mental health is just not my bailiwick. But, it's an important issue. It's something that we need to be mobilizing around, especially if the CDC statistics are correct, that a significant proportion of the refugee population is suffering from depression and anxiety issues. That's something that needs to be addressed. But again, I just want to say, if you're a refugee and you don't have good access to healthcare, you don't have medical insurance. I have to say the community I was working with, most of them were not insured. They weren't medically insured. They didn't have money. They wouldn't be going to mental health services, They didn't have a social safety net. I mean, they were on their own in terms of trying to take care of their health. And so we just really need to learn more about this population. Again, just another one of the issues that is poorly studied, poorly addressed in this country.
Okay. Rachel Farrell has a question for you. Given the current conditions with the pandemic, many couples have either had to defer their hopes of IVF or other assisted technologies due to the risk of receiving what might be considered unnecessary medical treatment. Do you know how this is impacting the Arab populations in the States, given the importance of Arab couples having children?
Thank you, Rachel. Rachel's one of our wonderful doctoral students working with Syrian refugees in France and in the Netherlands. Yeah, I don't know exactly how this issue of COVID and having to delay everything is affecting the Arab refugee community, Rachel. I mean, again, another research project that somebody needs to do. But we do know that COVID has massively affected couples who are trying to conceive. They're having infertility problems and they are having to wait. A lot of IVF clinics were required to shut down, including in this country. And so we know from many reports in newspapers, actually the British newspapers have been really following this closely, people's sense of lost time, that they couldn't get access to care, especially for women who are nearing the sort of end of their reproductive lifespans. They're in their late 30s and early 40s. It's a sort of last chance for them to try IVF, and being locked out of these technologies, it was a crisis for many people. I do have to say, I think IVF clinics did in this country open up. I know that the Yale IVF clinic did open up this summer and has been, treating people. But again, depending on what happens with COVID in this country and whether we face another crisis of COVID in this country, we might end up, seeing more shutdowns of IVF clinics. And so this is for people who are going through infertility in this COVID period. It's been very challenging. I can tell you that.
Well, we've reached the end of the session. Marcia, I want to thank you so much for this wonderful conversation. I also want to thank all the participants for asking some great questions.
And I want to thank you, Kaveh, so much. It was just wonderful to have you as my host. And those are great questions, everybody. Thank you so much for tuning in and posing those questions. I appreciated that.
Thank you all, and have a wonderful afternoon.